Hi, everyone. Thank you for joining us today. My name is Fajer Saeed Ebrahim. Fajer rhymes with ledger, if that's helpful. I use she, her pronouns, and I serve as the Senior Director of Policy at the National Asian Pacific American Women's Forum, or NAPAWF. I lead NAPAWF's policy and research strategy. At NAPAWF, we work to advance reproductive justice for Asian American and Pacific Islander women and gender expansive people across the country, grounding our work in the belief that everyone deserves the power to make decisions about their own bodies, their families, their futures, with dignity and without fear. I'm really grateful to be in conversation with you all today. In partnership with Lake Research Partners and Sprout Insight, NAPAWF recently released Beyond the Labels, AAPI Women on Abortion Care, Dignity, and Criminalization, the largest national, multilingual, and disaggregated study to date on AAPI women's views on abortion care and access. This research reflects voices across more than 25 ethnicities and includes in-language engagement that is too often missing from national data. And that piece is really important because for far too long, AAPI women have been treated as an afterthought in both research and policy conversations. Our communities are often rendered invisible through aggregation or misunderstood through narratives that flatten who we are. This study pushes back on that. It gives us a clearer, more accurate picture of how AAPI women are thinking about abortion as something deeply connected to their health, their families, their economic security, and their sense of safety. The results are powerful and they're clarifying. We see that AAPI women overwhelmingly view abortion as a personal decision, not something that should be dictated by the government. We see that experiences and perspectives vary across communities, shaped by culture, language, immigration status, and lived experience. And we also see that many AAPI women are navigating real and compounding fears about surveillance, criminalization, what it means to seek care in a system that doesn't always feel safe or accessible. All of this underscores why this conversation matters right now. We're in a moment where abortion access is increasingly criminalized and where those restrictions intersect with immigration enforcement, language barriers, and gaps in culturally sensitive care. Without a clear understanding of where AAPI women stand, policymakers and advocates risk advancing solutions that deepen existing harms. We know this, good policy requires good data, but more than that, it requires listening, really listening to the communities most impacted. And that's what this research is intended to do. Today, we'll walk through some of the key findings from the report and hear more about what they mean for how we show up in this moment. And I'm honored to be joined by two incredible leaders in this work. First, our very own Christina Baal-Owens, our executive director. Christina has built her career in the labor and immigrant rights movements, working in deep partnership to expand civic engagement and build power in communities that are too often overlooked. Her leadership has consistently focused on challenging systems that marginalize women, especially women of color, immigrants, those in rural communities, and low-income people. Her work is also deeply grounded in her lived experience as the daughter of Filipino immigrants and as a mother to two wonderful young daughters, perspectives that shape her commitment to dignity, equity, and collective power. We're also joined by Celinda Lake, president of Lake Research Partners, who brings decades of experience helping to translate public opinion research into meaningful strategy and action. Together, they'll help us unpack what the data says and what we should do with it. Before we get started, just a quick note on format. We'll have time for questions at the end, but please feel free to drop your reflections into the chat throughout the conversation. With that, Christina, I'll turn it over to you to share more about the study and what it means for our communities. Thank you.
Thank you so much, Fetcher, and thank you for everyone who's attending this virtual event on a Friday afternoon. We're so excited to share this research and really appreciate you all being here. So as many of you are all too familiar, as abortion bans expand nationwide, AAPI women are navigating a policy landscape that increasingly destabilizes their health, safety, and dignity. These impacts fall disproportionately on AAPI women, especially those navigating economic insecurity, uncertain immigration status, caregiving responsibilities, and barriers to culturally and linguistically appropriate care. And at the same time, AAPI women are among the fastest growing segments of the electorate. Yet, we still remain one of the most understudied, underreported, and mischaracterized groups in the country. And this is why NAPAWF is proud to present new research uplifting the perspectives of AAPI women across more than 25 ethnicities. Too often, AAPI women API communities are excluded from dominant abortion narratives or misrepresented due to data gaps and persistent myths about safety and economic security. This study helps fill that gap, offering rare, disaggregated insight into API women's views on reproductive justice that is grounded in lived experience rather than assumption. Because that reality is that API women's perspectives are not monolithic. They are nuanced, diverse, and shaped by culture, language, immigration status, and lived experience. But across that diversity, what we did find in data from this report was groundbreaking. There are shared values, a belief in autonomy, a rejection of criminalization, and a clear understanding that abortion is healthcare. Our findings show that API women already support the core principles of reproductive justice. The challenge isn't persuasion, it's connection. When abortion and reproductive justice are clearly linked to what API women care most about, autonomy, safety, and the well-being of their families, they are ready to engage and use their political power. Trust is a critical component of this, especially in an environment shaped by stigma, misinformation, and rapidly changing laws. For many API women, trusted messengers are not national headlines or political figures, but people rooted in care and community. Medical professionals and those with lived experience consistently emerge as the most credible sources of information, with nearly 80% trusting doctors and 74% trusting community clinics, healthcare providers, and nurses the most. In multilingual, culturally diverse communities where stigma and silence persist, trusted messengers are often the bridge between confusion and clarity. Without accessible, culturally relevant information, misinformation fills the gap and we lose the connection. After that, even strong support for abortion access may not translate into informed views or action. Our hope is that with these findings, we can build API communities' understanding and support for more informed dialogue around abortion and its enforcement as a crime. We aim to support AAPI serving organizations and allies with this data to strengthen advocacy, healthcare access, and education efforts. The Beyond the Labels research is also a powerful tool in equipping our elected officials and candidates with evidence to shape policies and share effective public messaging. And with that being said, I'm so excited to introduce Celinda Lake, who can dig deeper into this. Celinda Lake is one of the country's leading political strategists. Celinda and her firm Lake Research Partners are known for cutting-edge research on issues including the economy, healthcare, the environment, and education, and have worked for a number of institutions including the AFL-CIO, SEIU, CWA, NARAL, Human Rights Campaign, Planned Parenthood, the Kaiser Family Foundation, and now NAPAWF. And we're so excited about it. We are doing it again, and we'll hopefully be sharing that research with you going forward. Her international work has included work in Liberia, Belarus, Ukraine, South Africa, and Central America. Since its formation, Lake Research Partners has become one of the most respected polling firms in the country. And I'm so happy Celinda was able to join us today. So I'll pass it off to her to discuss the report's key findings.
Thank you so much. It is such a privilege to be here. And Christina, thank you for that extraordinary introduction. The eloquence of your words is really powerful. This is such an exciting survey for us to be part of, and such an exciting research effort that included focus groups, because it is really one of a kind. It is, as has already been stated, the most in-depth survey of its kind, really looking at the issues, looking at the language, looking at the linkages, and really exploring the diversity in this community and bringing the voices of this community forward. I want to acknowledge the incredible team and then in the organization, in the National Asia Pacific American Women's Forum, which is just unparalleled in its work. And then I want to acknowledge the research team that we worked with, headed by Kate Gormley and Alicia Snell on our end, and Sprout Research, Kathy Bucklow and Lisa Mills, who were incredible partners in this work. So it does take a village, and there was a village involved in this work. And I want to, without further delay, jump into the numbers, because I think you'll be as excited as we are by them. And there is a host of other data that can be made public to you. All these slides are available, so you can just sit back and enjoy the briefing. I'll just quickly remind you of the methodology if we look at the next slide, which includes in-language groups across all of the diversity in the community. And again, want to really acknowledge the resources that were put to the table to do this right. And then the survey research methodology, which was a very large sample. If we look at the next slide, of 1,400 people, and again, in 6 different languages. This is just so exciting, and you'll see that that in-language work was a critical finding, actually, in the research. So let's go look at the key findings. Then I'll show you some of the data and see if you draw the same conclusions. So AAPI Women overwhelmingly support abortion care. It's a very pro-abortion care community. It is a community that sees abortion care as a critical component of reproductive care and of health care. And they believe it is essential for the health and well-being of pregnant people. And they do not believe it is an isolated political issue. The frame that AAPI Women bring to the table is quite broad. And we did this survey at the end of 2025. And in a lot of other communities, the abortion issue had gotten more narrow because people thought, well, it's kind of resolved, it's done. Not true in the AAPI community. We looked at the linkage between criminal justice reform and enforcement and abortion. And these are 2 important issues to the AAPI community, but they did not see a linkage between the 2. And they were adamant that abortion is a healthcare issue, not a crime, and pushed back very hard about the criminalization. If anything, our biggest problem was not agreement with the criminalization of abortion, but rather skepticism and lack of knowledge of the full range in which it is still happening. There's a very strong belief in equitable health care, and the consequences of criminalization are underestimated, dampening the urgency, but there's a lot of urgency already of this as a key healthcare component and as an equity issue. Immigration enforcement and criminalization deeply intertwined in AAPI women's lives. Laws that punish healthcare decisions feel especially risky for immigrants already living under heightened scrutiny. And in fact, a topic for another day, there is a massive underestimation of the engagement of the AAPI community around the immigration issue. AAPI women are very aligned on reproductive justice and engaged by it. And they feel that AAPI women face a huge number of barriers to the service, to the information, and to an open dialogue. It's a very integrated and complicated schema that exists out there, of a mindset. People believe that there's everything from family expectations to religious constraints to lack of trusted familiar messengers, which are very important in the AAPI community. And by the way, there is no trusted messenger greater than the doctors involved in this kind of healthcare. So if we look at the next slide, AAPI women, as just a basic orientation, overwhelmingly support abortion care, view it as a component of reproductive care and essential for the health and well-being of pregnant people. It's not seen as an isolated political issue. It has not narrowed, and their views have often been ignored as they were very expansive. And the community should be much more engaged in working with the groups here and AAPI women because they are so activated and so comprehensive in their view of this issue. If you look at the next slide, you'll see that 2/3 of AAPI women believe abortion should be legal and generally available. That's the dark and light blue numbers, subject to only limited regulation that is necessary, and that it should remain legal in many circumstances. So they're very pro-choice in their attitudes. Only 7% believe that abortion should be always illegal, despite religious and cultural constraints. So this is a very pro-choice community, and these numbers are even higher than a number of other groups and the numbers overall. Having said that, this is a very nuanced, complex issue, and it is very, very rewarding to have been part of a study that actually looked in depth rather than superficially, in depth at all of the communities, in depth at the nature of the issue. So in terms of all those focus groups, if we look at the next slide, you can see here references to all kinds of religious traditions and teachings, immigration histories, family expectations, cultural norms that shape understanding of abortion, often long before people have a personal experience. And that constitutes, frankly, one of the barriers to abortion care in the community. We asked people in the next slide, we gave them a list of words and phrases that people use to describe abortion, and Asian Pacific American Pacific Islander women picked overwhelmingly that abortion was a human rights issue and personal decision making. And notice that the rights issue very, very dominant. And this is all AAPI women. In other communities, activists see abortion as a human rights issue, but in the AAPI community, it's seen broadly as a human rights issue as well as a personal decision making. And then clustered right behind that, safety and freedom. Notice very little, orientation toward this as a political issue. Very limited orientation toward this as a controversial issue. And people believe way more that it is life-saving than taking a life by like 3-to-1. So really interesting and again, very nuanced, very textured belief around values. If we look at the next slide, AAPI women solidly believe that access to abortion is part of a broader continuum of reproductive care. They also believe it's a solid part of care in general. So 2/3 of AAPI women say the issue of abortion is personally important to them. Only 1/3 consider it very important, but many of the women in this sample were beyond reproductive age, the age of having children. So these are good, solid numbers. But even more important and with real intensity is the protecting rights of people who are pregnant and could become pregnant. 86% say that is important. 61% say that is very important. This is almost what we call a valence issue or a core value. And it's one of the interesting places where the concern for this right for others actually even outweighs the concern for oneself. Normally on issues, concern for oneself is higher than concern for other people, but not in the AAPI community and not on this issue. And these are really, really strong numbers. If we look at the next slide, personal decision-making without government interference or government intruding, very, very strong. And again, almost at the level of a core value. We asked people, do you agree or disagree with this value? 84% said they agreed, 59% strongly, 12% said they disagreed, only 4% strongly disagreeing. That's below the margin of error. And the AAPI community is not confused. They'd like more information about the barriers and the resistance, but they're not confused about this issue at all. Only 4% said they were not sure. The numbers are very strong across all of the ethnicity. 88% of Japanese respondents, Japanese American respondents, 88% of Korean American, 89% of Chinese American, 85% of Vietnamese American, 85% of Indian American, and 79% of Filipino American, brought down a little bit by their high rate of Catholicism, but still very, very, very strong. If we look at the next slide, this sea of red is one of the most dramatic findings in the study. So we asked a series of barriers, and people believe, AAPI women believe overwhelmingly, that the most significant barrier to someone getting an abortion is state laws that ban abortion. But the remaining top tier are accessibility and affordability, lack of insurance, cost of care, limited or no providers at home. And Asian American Pacific Islander women believe that all of the items tested are barriers to someone getting an abortion, including, by the way, immigration status, which is seen as a barrier by 2/3 of AAPI women and gender fluid people. So you can see overwhelming belief in the number of barriers. This data is a lot more intense. And this is why this issue has not become narrowed in this community. In other communities, people think the barriers are down. They may be present in some states, but the barriers are down. In the AAPI community, it is seen as there are a lot of barriers with a lot of intensity. Within the mainstream, if we look at the next slide, within the mainstream policy and political landscape, AAPI's women's values of personal decision-making, rights, safety, and freedom align with the solid majority of support for the right to abortion in all 50 states. You can see here that people do not want a state-specific approach. And AAPI community women and gender fluid people very, very strong about believing this should not be state-specific, and having a lot of awareness of their community spread across states, the movement of people, their kids moving, very, very strong norm that this needs to be a federal law in all 50 states, not a state-specific law by margins of almost 3-1. You can see in the focus groups, if we look at the next chart, that these numbers were amplified and very well expressed by their own opinions. Everyone in the US would have the same rights. You know, I mean, if we're all equal, then wherever you live, at least we're all following the same law. I think that it can be challenging because in a state, what is legal then is making a crime, right? I think you need to have some kind of uniform law and regulation all throughout the state. I think women's rights should be protected. It should not vary in different states because it's naturally women's rights and you should not be discriminated against. And notice these quotes are in folks that are older, in folks that are speaking different languages than English. Very, very, very strong norm. If we look at the next slide, AAPI women support both criminal justice reform and enforcement, but do not extend those punitive views to abortion, and are adamantly opposed to criminalizing abortion, but also somewhat skeptical that it's happened. So you can see here the criminal justice views, and you can see people are divided a little bit on, do you think the system is fair or not fair today? And then most people feel like they're spread all over the place in terms of whether our laws are too tough, not tough enough, or about right. There's really a very nuanced and diverse opinions about the criminal justice system. However, if we can draw one conclusion, it would be the next slide. People overwhelmingly reject abortion criminalization, but underestimate its likelihood. Let's go see those numbers. Now, people start out saying, I know a lot. A majority of AAPI women report knowing some or a lot about their state's abortion laws. Awareness of criminalization laws more limited. Only 48% say they have seen, read, or heard something recently about that, or 40% when it's against helping others. So there's a limited awareness of the application, a lot of awareness about abortion laws. What's more important, because it's not actually built on current knowledge, but built on core values. If we look at the next slide, you can see that 3/4 of AAPI women express concerns about laws that punish people who seek abortion, provide abortion care, or assist someone in obtaining that care. And there is real intensity and very little diversity. 3/4, 75, 75, 75, 53, 52, 51. What this says is this is not a nuanced view. This is not a circumstantial view. This is a view, this is levels of concern, and it is anchored by a core belief. We then explore the emotional content. And if we look at the next slide, and one of the things I love about this study, and I love about the way that the National Asia Pacific American Women's Forum guided us in our thinking, was to look for the emotional connection, something that Sprout Research, our colleagues, also really talked about a lot. And when we asked people, how do you feel about states punishing people who try to get an abortion or provide an abortion? They were concerned, angry, and disappointed. Really, really strong emotions, and the kinds of emotions that activate people, that mobilize people. You can have other emotions that show emotional resonance, but make people less likely to be active. These are the emotions that really motivate people. The next slide I'll show you a little bit complicated, and you can spend some more time on it. But basically, the bottom chart is showing the worst outcomes that can come from criminalization, and it's a variety of arrests, losing licenses, and people think these would be very bad outcomes, giving them ratings from 63% to 69%. So people think that is a very bad thing to happen. That said, they also think the worst things are not that likely. The top grouping is how likely do you think things are to happen? And the things they think are likely to happen are the things that people think are not as bad. The things that people think with real intensity are the worst outcomes, they think are less likely to happen. So the things they think are most likely to happen is you'll have to travel to another state, you'll use medication, you'll go outside the medical system, you'd be fined, you'd be afraid to use certain kinds of providers for fear of reporting. But people think that these are the most likely things. They think it pretty unlikely that people would be arrested, even though they think that is by far the worst thing. So they are adamantly against criminalization, but they are underestimating the likelihood of it and limited awareness of how much is occurring already in some of these states. If we look at the next slide, the next section is on engagement. And what you will see here is that AAPI women show a tremendous willingness to engage civically. There are some generational differences in tactics, but still a great deal of engagement. If we look at the next slide, you can see that people are willing to vote this issue, both in federal elections and state and local elections. They're willing to sign a petition. They're willing to speak to friends or family. This is a really important one. It's a little lower, but still strong. And this is important because in the AAPI community, there is real concern about division. And remember, one of the major barriers was assumptions about how the rest of the family would feel and cultural and religious norms. If we look at the next slide, you can see in the willingness that people are very willing, and excuse me, the people who are most willing are actually younger AAPI people. One of the things that is hampering, if we look at the next slide, AAPI women taking more action is they don't have the information they need. So what are the information sources? And you will see here, we looked in depth, YouTube really dominating, but Facebook news websites, local TV, Instagram, TikTok, cable TV, and cable news, all very, very strong news sources. Notice newspapers, which used to be very big, international foreign outlets, podcasts, not very big sources of information. There are differences by age. There are also differences by ethnicity outlined on the right side. But basically, you would conclude here that social media, a very, very important source of information in the AAPI women and gender fluid community, and that you have a lot of different sources of information, but the ability to run very, very aggressive social media campaigns. If we look at the next slide, who do you trust? People trust overwhelmingly doctors. This is by far the most trusted source, followed right behind by people who've gone through the experience, clinics, and nurses. You see a dominance here of real interest in finding out more about what is going on from the medical community. People that they don't trust that much for information in this area: TV and news reporters, faith leaders, cultural leaders, social media influencers. So one can run a real campaign on social media, but it has to be with medical spokespeople, not social media influencers particularly. If we look at the next slide, when it comes to sharing information about the topic of punishing people who try to get or provide an abortion, AAPI women would prefer to get that information through personal conversations, followed by online, YouTube and social media, Facebook and Twitter or X. This in-person conversation, very, very interesting and complicated scenario, right? Because in-person conversations are also a place where people have great preference, but also some concern that they will divide the family and that they will come up against people who don't share their views. One of the things that's so important about this work is just getting out to the broader community how overwhelming the support for abortion care is, how it's seen as a fundamental right and personal decision-making issue. AAPI women vastly underestimate the broad reach of this issue in their own community. People are most interested, if we look at the next slide, about getting fact sheets and videos, less interested in charts, and a lot of people like a lot of different kinds of information. One of the three most important findings is on the next chart that I will share with you. And you'll remember this was by far the most diverse study that's ever been done that we know of, certainly in this area, with language diversity and language accessibility, very, very important in the AAPI community. And it's important, we've done other research on this, it's important even if you speak English, because AAPI women really want to make sure they're not making a mistake. They really want to make sure that they get the information. So they like it available in other languages as well as English. And they want to pass it on in other languages as well as English. Both their friends and their families and themselves want information in languages other than English. And these are solid majority with some real intensity. You can see on the next slide in their comments on the focus groups how people express it. It's really important to have information in Korea for people who aren't fluent or don't speak. We're a nation of immigrants. We come from all over. Information needs to be distributed to all people in multiple languages. There's a very, very strong equality norm in the AAPI community, and that equality means in access, language access. We have a lot of immigrant friends. Remember, people want to have this conversation with friends and family, and that even if their skills in English are quite good, they're worried about limiting that conversation if the materials and the information is only in English. And people very clear, definitely in different languages. The last thing we looked at, if we look at the next slide, is messaging. Remember, if we look at the next slide, and this was the forum's instincts from the get-go, and they are so right. And their work is really, really anchored in core values, and that is absolutely what this community firmly believes in. There's real intensity when things are value-based. We consider a statement to be a good number when we have 45% strongly agreeing and 60% or more agreeing. You can look on the right-hand side and you'll see that all of our statements have a solid majority strongly agreeing and 3/4 to or more agreeing. So these are very, very strong statements. They're anchored on access and access without punishment, safety, affordability, freedom, no government intrusion, and no punishment. And there is a broad range here of statements that are testing very, very, very strongly. And again, those messages around access, safety, affordability, and freedom, no government intrusion, and no punishment. The last slide I'll show you is the message triangle, the dominant themes. And you can see here, family to better than Roe, to ideal naming or not naming, AAPI. And notice all of these messages center on human rights, personal decision-making, protecting rights, which in the AAPI community is not just an activist orientation, it's a fundamental across-the-board orientation. Inclusivity of friends and families. Remember, this is a barrier in people's minds, but it is also the #1 people that they want to have this conversation with. And asset messaging, positive messaging, not all the problems, but what we want to assert, what core values we want to have, and which address the issues of access to legal, safe, and affordable abortion. So that's the data. I think you'll agree, an unbelievably rich and sophisticated study, and by far the most comprehensive that we've ever seen or been participant of, and just really, really excited to be presenting this really solid, grounded research in what is a very unique and important community. So let me stop there and turn it back to the forum.
Thank you so much, Celinda, and thank you so much, Christina, for that thoughtful and grounded conversation. There's so much in this research that really challenges the assumptions that we have about our communities and really pushes us to think more deeply about how we approach this work. We are going to go ahead and open it up to questions. So hopefully folks, I can't see the chat, but hopefully folks have been sharing some reflections or can go ahead and do so. But I can kick us off with some questions. Maybe we can start with you, Celinda. Did anything surprise you about how people understand government involvement specifically in their reproductive decisions, especially when it comes to surveillance or enforcement?
Yes, there were 3 things that I thought were kind of surprising. One, which we see elsewhere, is no political interference or intrusion. So that's very strong. What really surprised me is the commitment to a federal law over a state law. Since this is a very diverse community that thinks it faces unique barriers and unique factors, one might argue and think, well, they're going to want state-specific, community-specific. No. They wanted equity. Is a very strong sentiment, and they wanted equal access. And this is a community that perceives itself and greater family members to be very mobile. It was also interesting. I don't know anybody else that's done quite as sophisticated an exploration of the linkage with criminal justice reform. And this community wanted criminal justice reform, and as well as a tougher legal system. So there was a combination, but that was totally devoid from the views about abortion. And simultaneously, the community was very, very strongly against criminalization. And our problem, again, was not agreement. Our problem was skepticism.
Thank you for that, Celinda. I'm seeing a question from Nikki in the chat. Can you discuss the decision to include only women and not men studied? So wondering if Christina, Celinda, you want to kick us off, and I can also jump in.
Well, some of that, and I would love to have Kate jump in here too. Some of it was budget driven, obviously. Some of it was also just looking at who is, and this was women and gender fluid people, so pregnant people, people that can get pregnant. The decision was to look at people that were most affected. And so that was another reason. And the people that will be the activists on this issue, which in every community has been more the women. But it would be fascinating to look at men too. So some of it was just, there was already such a deep commitment to language and ethnicity and all of the diversity, geographic diversity, that there just had to be some limits put somewhere.
I can add to that NAPAWF women are core to NAPAWF's mission, women and gender expansive people. We are also really committed to centering the stories of communities that are affected. So pregnant people is implicit in that. I think, to Celinda's point, it would be interesting to see as allies where API men are in this. But for this study, we really wanted to focus on, and a lot of NAPAWF's work focuses on centering API women, girls, and gender expansive stories in policy discussions, because those are the stories that are, and the lived experiences that are often marginalized.
Thank you both. I'll just add, we are internally thinking through how we expand the research in future iterations to involve partners, families, and just broader communities, especially as we think about creating effective comprehensive policy. So we understand that they're a critical part of the conversation and a critical part of the solution. Seeing another question here. Can you say more about what you mean when you say naming/not naming AAPI's messaging? Does it mean talking to them about how it impacts AAPI specifically? Does that impact how the message is received? And this is from Jonah Hilario. I hope I did not butcher your name, friend.
Yes. So naming helps, and also language is actually the real key. But we can just well, let me read you just the whole message, because I went by that pretty fast. And then Kate, love to have you jump in here. When someone decides to have an abortion, it should be safe, affordable, and free from punishment or shame. State laws that ban or restrict abortion hurt communities that already have a hard time getting health care. Asian and Pacific Islander communities, people with low incomes, and people who don't speak English well are all harmed. Decisions about pregnancy, including abortion, should be made by each person, not by politicians. So that was the message that was labeled that way. And it is important to name the community for visibility, so people see themselves in this. This is a very personal conversation. But Kate, please add to it.
Thanks, Linda. I would just add that we did an experiment where half the people who took the survey heard that language that Celinda just read, and then half the people heard very, very similar language, but it didn't explicitly call out Asian American and Pacific Islander people. And what we found is that, at least for that message overall, when we look at the total numbers, it didn't make people say this is more convincing or less convincing when we did or did not call out Asian American and Pacific Islander people explicitly.
Thank you, Kate. Christina, question for you. One of the most striking findings is that 84% of AAPI women see abortion as a personal decision, not a political one. How do you think that should shape the way advocates and policymakers talk about the issue?
Thanks for that, Fajer. So there's a couple of things I want to lift to the top. I was really struck by how, Celinda, you just framed that reproductive rights and justice is a core value in the API community, that the numbers really rise to core value. And, especially in a community like ours, in a study like this that looks across 25 different ethnicities. And, we have to remember that the API community includes immigrants and US born, it ranges in age, it ranges geographically. So the fact that that number is rising to where it is really does show a lot about where our community stands. I think that the piece about being in language also is really important, that even if someone is bilingual, having the ability to understand all of the nuance, which we know is really communicated through language, is important. So I bring that up because I know that in a lot of this work, because it is budget driven, we do look at, I always feel like the phrase I hear in translation conversations or language access conversations, like, what the most juice for the squeeze or whatever. I'm having an immigrant moment where I'm forgetting that term, but where we're looking at, like, if someone speaks English, why do we have to pay for it? Or, what is the biggest group? But in healthcare decisions, and overwhelmingly seeing that abortion is seen as healthcare, that nuance is really the difference between life and death. And, we really need to acknowledge that people want to make fully informed decisions and understand all of that. I just wanted to say that, when we looked at, across different pieces of the community, um, particularly the younger US born or more civically engaged groups, language around bodily autonomy and individual rights really resonated. But in other communities, like immigrant communities, framing abortion as part of making responsible decisions for your family's well-being and stability can be more meaningful. And I bring that up also because, again, a lot of the data we have looks at AAPI folks as a monolith, and just acknowledging that even within our community, different messaging resonates with different communities is important. We are doing some work, and Fajer has taken the lead on a lot of this, of doing some trainings with legislators about how to talk about abortion access and reproductive justice with their constituencies. And this kind of nuance and this kind of detail really helps people be able to communicate that. And then, I just also, I know we've talked about this quite a bit, but just highlighting that API women overwhelmingly reject the idea that government should dictate these decisions. I also, I think we, and Celinda, correct me if I'm wrong, we talk about it not being a political issue, but it really, to what I had read and what I had understood is that that meant just not having government, the government should not be the authority on this. I thought it was really interesting also that even in religious communities like Filipinos, which is where the community that I come from, that doctors far outranked religious leaders. And just, I think we need to be looking at, we always use the term trusted messenger in this work, and it is very clear in the API community that the trusted messengers are medical professionals. Again, really going back to seeing abortion as healthcare, as a healthcare decision. And, I think as advocates, we need to be really working closely with with physicians and nurses, which also, if we look at the API community, we are heavily represented in that community. We really need to be working closely with medical and healthcare professionals and involving them in our advocacy.
Thank you so much, Christine. I want to lift up a comment in the chat. The language access piece is so key. I've heard from funders that funding language access work in the AAPI community is not worth it, which is disheartening. Yes, the work is cut out for us.
I mean, yeah,
it's also,
if you look at API, it's over 100 languages, right? No one is saying it's cheap. No one is saying it's an affordable community to outreach to. But if you're also looking at the numbers, and if we're caring about what happens and who we're organizing either with or against, the API community is really rising as a winning margin in many states and is an increasingly active electorate. And we look at the stats of motivated to, that is not the same as voting, right? Like we have to look at, if people are motivated, it is still our job as advocates and for campaigns or whoever else to be communicating to folks in language through trusted messengers.
And the other thing that's vastly underestimated, because I'm in the same room as you are, Christine, and it's so ignorant and just totally misunderstanding the point. They go, well, it's only this percentage that are Korean speaking only or whatever. That's not the point. This community, people in this community take their decision making very seriously. This is a fundamental rights issue. It's a fundamental healthcare issue. When they take action, they want to do the right thing. And so they want to check it in 2 languages to make sure that they're not making a mistake. And this is really, really important in voting materials, as you said, and also in initiatives. When these initiatives are on the ballot, we are not translating nearly enough of this initiative information into these different languages to maximize participation in this community. I think, if I may, I think there's an anxious question about the sample. And first of all, we're glad to provide all level of detail, but just to cover it basically for you, the survey respondents were drawn from an online panel, and then they were screened to be adults residing in the US, and we offered the survey in 6 languages. And there is a slide, and you can get access to all of these slides that outlines all of the languages and the methodology. And if you have any additional questions, we're completely transparent on the methodology. So very glad to answer any questions that you have. But basically, online sample and then screened to be adults residing in the US.
Thank you so much, Celinda. We have a question in the chat from Amy at Gumacher. Hi, Amy. Were there any noteworthy or surprising nuances or differences between communities other than the differences related to age/generation that were mentioned?
Yes, there's a lot of differences actually, and some really interesting ones. Like, I don't know any study that has spent as much time looking at like Hindi. And it's hard to say because there are, if I make cut to the chase, Amy, there are slides that we develop for every community. So maybe we can send those slides to you because the fundamental things are the same, but there are quite a few nuances. And there's quite a bit of diversity, depending on the community that you're in. And even the same messages tend to test the same, the top, but the rank order of those is very different.
Yeah, wondering, Kate, I know you were also super involved in the research, if you want to lift anything up, but if not, we have other questions. So,
Sure. Sure. Some of the things that I thought were really interesting was the how important is it to protect the rights of people who are pregnant or who could become pregnant. And I did love that language, pregnant or could become pregnant, because it is so expansive and it's how so many of us experience life for a very long part of our lives. So one interesting finding to me, Filipino women, and I know we've already touched on this, they are much more religious than some of the other ethnic subgroups that we looked at. And because of that, they are less likely to hold some pro-choice views. But they were among the most likely, if we look across the biggest ethnic subgroups that we could look at, to say it's personally important to protect the rights of people who are pregnant or could become pregnant. 66% of Filipino women say that's very important. And that's just a really strong value. Also, another interesting difference is for some, responsibility came up as a value when they think about abortion. And when we did the focus groups, responsibility was this, it didn't just mean like, I'm going to think about this decision deeply. It also meant I'm responsible to all generations. I'm responsible to my family and I'm responsible to future generations. So I thought responsibility was such an interesting value and such a unique value that really the other cultural and religious values that rise to the top for Asian American Pacific Islanders that you just don't see when you look at Anglo audiences or Black audiences or Hispanic or Latino audiences. Let me try to find one more interesting thing I can tell y'all about value.
There were two others that I
sure.
thought
Go ahead, Celinda.
no, thank you, Kate. There were two others that I thought were really interesting. Korean American women and Chinese American women were really worried about making sure that the laws were consistent across all states. That was very, very, very salient to them. So salient it became a top message. And then there was a real difference between, there was some nuance in terms of how much people wanted to be proactive and improve upon where we were, not just go back to Roe. Everybody in the AAPI community didn't want to just go back to Roe, they want to improve. But that sentiment was particularly strong with Vietnamese Americans and Japanese Americans. So just some really interesting nuances in terms of orientation and community experience. And then, as Kate was saying, religiosity was a huge variable. And you've got this is again, to go back to other people's points, this community is treated as monolithic. It's one of the most diverse communities in the US, and it's not monolithic at all. And there is a huge range of religiosity here in this community.
thank you so much. I'm mindful of time. I think we probably have time for one more, maybe a two-pronged question, if I may, for everyone who's willing to share. So what are the risks if we don't take this research seriously, right? Especially for our communities who are already navigating multiple systems of scrutiny. And then relatedly, if you were speaking directly to leaders across sectors, whether we're talking about policy or healthcare, what's maybe one thing you want them to do differently after seeing this research?
I can jump in. I think we've And in the chat, we're seeing the importance for language access. We know that those laws are often at the state level, but really doubling down on language access laws and the enforcement of them. Also, when there are laws, having access to things like language lines and an actual ability for translation that doesn't fall on other family members is really important. And we're at risk of API women are already very marginalized within the healthcare system. The data is really non-existent. What did exist is being erased by the current powers that be. And also, as a voting bloc, there's just so much not understood about API women and girls or API voters in general. I mean, even the voter data often misidentifies our communities since it's based on last name recognition. So we are at risk of one, API women really falling further in the cracks of the healthcare system, of not getting the information and the care that they need, but also, for leaving votes on the table in these coming cycles. We are a growing bloc. There's a lot of data that shows the motivation is there, that we have done some other work also with our coalition, the Intersections of Our Lives campaign, to show that one, motivation and actually plans to vote are different, but that if people are communicated with and are educated and are engaged in a meaningful way and recognize their lived experiences in what they're seeing, that there is a lot of civic engagement that can come from that.
Celinda, any final thoughts from you?
My final thought is I would follow Christina into any battle. So Christina, you are amazing and your whole team is amazing. I want to thank our team, and I really want to thank you for the commitment and this was one of the most rewarding great projects we've ever worked on. And I think I speak for the entire research team here because of how sophisticated and thorough it was, because of how it took on conventional wisdom and asked non-conventional questions. It's really exciting research. So thank you.
Thank you both. In the last 2 minutes, I just want to leave us with a few takeaways. So first, this research makes clear that our communities are not monolithic, right? Any serious policy or advocacy efforts should reflect the diversity and the nuance and lived realities that we've seen really highlighted in this research. Second, we see overwhelmingly that abortion is understood as a personal decision, not a political one, and that should really shape how policymakers and leaders approach this issue. And finally, the stakes of getting this right, as both Christina and Celinda have named, are incredibly high. This moment of increasing criminalization and surveillance, really failing to center the folks who are most impacted, actively creates harm. So we're hoping that this research is an invitation to lead with nuance and to listen more closely to impacted folks. Thank you, Christina, Kate, Celinda, for your leadership, and to everyone who joined the webinar and engaged in this conversation. If you'd like to stay connected or learn more about the report, we'll be sharing additional resources following this webinar. And thank you again for joining. I hope you have a wonderful rest of the day.